Heart failure is a condition with many faces. It can affect all ethnic groups and all ages, and it's important to know that older adults are not the only ones who develop it. Unfortunately, heart failure can even affect people in the prime of their life. The terminology gives the impression that the heart has stopped beating to be called heart failure, but that's not the case at all. The heart is still beating, but it cannot keep up with the body's constant need for blood and oxygen each and every day. What is heart failure? Heart failure is one of the most common reasons people over 65 are admitted to the hospital. Heart failure can take a long time to develop, leading to the heart losing strength and capability to pump blood throughout the body. Over time, as heart failure develops, the body will try to compensate for an inadequate blood supply. Stress hormones rise to keep the heart beating as blood vessels narrow to keep blood pressure stable. However, it's important for blood to continually reach the heart and brain, so to keep that happening, the body will reroute the blood supply from less critical tissue. Causes of heart failure. Multiple factors lead to heart failure. The most common cause is coronary artery disease, CAD. CAD can occur when arteries supplying blood to the heart muscle narrow due to the buildup of fatty deposits called plaque. Other causes of heart failure include heart defects since birth, a prior heart attack that damaged the heart muscle, high blood pressure, heart valve disease, being overweight or obese, diabetes, thyroid issues, alcohol or drug abuse, infection of the heart or the heart valves, certain types of chemotherapy. Faces of heart failure. The Heart Failure Society of America has developed a tool to help doctors and patients spot possible heart failure symptoms. F equals fatigue. If the heart cannot pump enough oxygen-rich blood to meet the body's energy needs, a person will experience a general feeling of tiredness or fatigue. A equals activity limitations. People with heart failure find doing normal activities more difficult, making them easily tired and short of breath. C equals congestion. Fluid buildup in the lungs can result in coughing, wheezing, and breathing difficulty. E equals edema or ankle swelling. If the heart's pumping power is weakened and cannot pump blood back to the heart from the feet and legs, excess fluid begins to settle in the ankles, legs, thighs, and abdomen, which can lead to rapid weight gain. S equals shortness of breath. Fluid that settles in the lungs causes a dilemma of making it more difficult for carbon dioxide found in used blood to be exchanged for fresh oxygen. Shortness of breath can also occur when lying down due to gravity allowing excess fluid found below the lung to travel up the torso. Diagnosing heart failure. When being seen for possibly having heart failure, your doctor will conduct a physical exam in addition to using two tools to spot the presence of this condition. One is an echocardiogram, a simple, non-invasive test that uses ultrasound to create images of your heart while it beats. Other findings pointing to heart failure include abnormal thickening and ballooning of the heart wall and malfunctioning heart valves. The second tool is to look for biomarkers in the blood to help identify early-onset heart failure. One such type of biomarker is B-type natriuretic peptide, which is released when the heart is under stress. How is heart failure treated and managed? The good news is there are many successful for managing heart failure. In the past, people with heart failure had an average lifespan after diagnosis of about 5 years. Here are some ways heart failure can be treated. Medications can be given to strengthen the heart, along with water pills to rid the body of excess fluid. Follow a low-sodium diet. Possibly treated with oxygen for use at home. In some cases, surgery or cardiac devices may be needed. Here are some lifestyle habits a person can do to manage heart failure. Take all medications prescribed. Weigh yourself daily, checking for weight gain caused by fluid retention. Keep track of your daily fluid intake. If overweight, lose weight and strive to reach and maintain a healthy body weight. Avoid or limit alcohol and caffeine. Consume a heart-healthy diet low in sodium, saturated fat, and trans fat. Be physically active regularly.